Hi, this is Dr. John Ziegler with Trinity Integrated Health and Wellness Center. Today I'm coming at you from Logan University, where I went to college at to receive my doctorate in chiropractic. And I want to explain today a little bit about what it takes to become a doctor of chiropractic. You know, we go through the pre-med program just like any other medical doctor does. I did mine at Northwestern State University. Many of the doctors you see in your community were in class with me. We were all taking the same courses: the organic chemistries, the inorganic chemistries, the physics, the biologies, the microbiologies, all that. Once you've completed all that, now you can apply to chiropractic school. I chose Logan because my mentor had come here, and it was just a wonderful university. Now, the chiropractic degree, in order to get your doctorate in it, is a 5-year program. And if you go straight through, you can do it in 3.5 years because you're set in a class and you go 3 semesters a year. What the normal semester is anywhere from 26 to 32 hours. So what I took at Northwestern in a year, I take every semester, and it's 10 semesters total. So when we get done, we're highly educated. We're very qualified to be treating the human spine. And in addition to that, we have 4 national board tests, which are very rigorous tests, and then you have to take a state jurisprudence test. And so just like a medical doctor has to take national board tests and has to take a state jurisprudence test, so does chiropractic. Oftentimes I hear the term, well, you're not a real doctor. And a lot of people think we take 6 months of education and now all of a sudden you're a chiropractor. Not even close to that. It is an extremely rigorous program. And I would par it along with medical doctors in any way, shape, or form. We take over 4,620 classroom hours in that 3.5 year period. In addition to that, we have to do internships and such to where we know where we're at in our skills before we're ever allowed to even go into the public and adjust. As a chiropractor, there's many times when we'll see conditions that they've tried everything in the medical realm. And I tell everybody, if you got a problem and you're taking a pain med or an anti-inflammatory to cover up that problem, as soon as that wears off, you still have your problem. Instead of just masking a problem all the time, why don't you do something to break up that area of injury and to heal it? And as chiropractors, that's what we do. We're highly trained in neurology and nutrition and biomechanics of the spine. Your brain controls everything that goes on in your body. There's not a tissue or cell in your body that the brain doesn't control, and it does it down through the spinal cord and out these nerves. My job as a chiropractor is to adjust these impediments in there called subluxations, which are misalignments of one bone on another. And it causes the nerves to become impinged, and where the nerves go to, that body part's not going to work as well, whether it's an organ like the stomach or whether it's a muscle. Our job is to go in and correct these misalignments, and when we do, the body heals just like it's intended. Not only do we do chiropractic, but we also do a tremendous amount of nutrition. Medical doctors take 3 hours of nutrition in their whole time that they're in medical school. We take much more than that. In addition to that, we take x-rays. I can read x-rays on par with most radiologists. I'm not a radiologist, but I'm very well trained in x-ray diagnosis and such as that. And so, as a chiropractor, we'll take an x-ray of your spine. We'll assess the whole body. We'll take a look at your spine and see what's causing the problem. If it's not chiropractic, I will certainly refer you towards your medical doctor or to a surgeon if that is something that's needed. And there's times when that is needed. Chiropractic doesn't cure everything, but neither does the medical profession. So instead of always running towards the medicine cabinet and taking a pill, why don't you try chiropractic? Why don't you allow us to come in, assess the body, see if we can heal it from a conservative realm. There's no side effects to chiropractic. It's extremely safe. We have very low malpractice insurance rates, much lower than medical doctors, because we don't cause near the damage of that. So come to Trinity Chiropractic and Trinity Integrated Health and Wellness Center. We have 2 clinics now. Give us an opportunity to assess your spine, see if we can help you, and if we can't, we'll refer you back to your medical doctor. But before you go reach for a medicine cabinet, why don't you try and let your body heal itself naturally? So I wanted to just let you know what our requirements are to become a chiropractor, how well trained we are, and I hope you'll give us an opportunity. Have a blessed day. Dr. John Ziegler.